Today I'm going to talk about role of homeopathy in kids or in teenagers. Over the past few months, we are seeing a lot of cases where parents are bringing their kids who are teenagers and who are adults to us for behavioral problems, like the individual is not sitting in one place or becoming very hyper, and the child is saying the same thing again and again. And in some cases, as the children are growing up into adolescence, the issues related to the secondary sexual characters or the sexual desires and masturbation, so many issues are coming up. So even though the child is getting therapies and and they are also getting some modern medicine, then also these kids are not settling down. So they have been referred to us because we are working in the space of autism, and not only do we run autism awareness campaigns, but we also work with these children with homeopathy, nutrition, and therapies also. So therapies they are already getting. So the role of homeopathy, we have seen a lot of wonderful results with homeopathy, and homeopathy is a safe stream of medicine and it doesn't have any adverse effects. But one should go to a homeopath who works in the space of autism and who has time to deal with these issues, because treating autism it needs a lot of time and to understand what's going on. So as a parent or a caretaker, if you're going to a homeopathic doctor, you should take proper details, like you should record the event, what is happening during the episode and what are the symptoms. You should write it down on a paper and take it to the doctor. So your homeopath is in a better position to help you. And have patience. A lot of times people think homeopathy will take a long time, and so they don't come to a homeopath because they want immediate results. But it is not like that. It is a misconception. In acute cases, homeopathy has shown wonderful results. So there's not like we have to wait till eternity to see a result. But as a parent or as a caregiver, it is your duty to give the details, proper details. Don't hide anything from your homeopath, because some things which are trivial, you may think these are trivial, but it may be very important for the homeopath to find the medicine. So once the medicine is given, see what is happening in your child. If the child is improving or if there is no change, report to the doctor. In our practice, in cases we are very acute, we take follow-up every 7 days and we tell them to keep reporting to us so that we know what's going on. So once these episodes get better or the child gets better, we put them on the constitutional homeopathic treatment, which is also a very important part of the homeopathic treatment. So don't be like, if the acute episode has settled down, it's all over, and don't go to the homeopath. Don't do that. When the child is better, we have to give certain remedies. So in long term, the child is improving over a period of time. So homeopathic medicine is very important in the treatment of autism, and we have seen wonderful results for the last 15 years in the autism space, and for the last 23 years we are in the field of homeopathy, and it's a very good science, but we have to practice it. It's not easy. It's not like you go read some books on homeopathy and start practicing. It's not like that. We have spent a whole lifetime understanding how homeopathy works and how wonderful the science is. So take the benefit of homeopathy. Go to a homeopathic doctor who works in the space of autism and take help. It can be a very good thing, or it can be a boon for the child. So let's keep our mind open towards an integrated treatment. Take the best from each pathy and put the child in the center space, so he or she gets benefited. That's what I would like to say. And at Dr. Joshis Center for Autism, we run a free second opinion for people who want to understand, and they can write to us from our web portal drjoshis.com. Thank you very much.